Hello and welcome to my end of semester learning reflection video. Let's get started. So one of the first articles that I really enjoyed was by Karnam and Raghavendra, and this discusses the surge in the number of patients who are informed. Informed patients are described as people who are well read on their medical conditions. They have an idea on the treatment they would like, and they engage in a lot of dialogue with doctors. These patients can be hyper-informed though, and there can be side effects to that. Informed patients are not always well informed. This article stresses that the role of doctor-patient relationships needs to change in order to adapt to the increase in the number of informed patients. Technology is a great thing in healthcare. With the advent of new technology, patients are capable of doing more research before appointments and taking their symptoms and coming up with a cause. The research can aid their care, but it can also prove to be a hindrance. These patients can be classified in 4 quadrants based on their authenticity and relevance. These are misguided, completely informed, confused, and misinformed patients. Each of these types of patients needs to be treated differently by their doctor. This relationship breeds the new role of hybrid doctors. Hybrid doctors need to follow a few guidelines, understand information flow, course-correct deviations, virtual consultation, lending, localization, and seasonal knowledge, and discussion-oriented medication. Hybrid doctors need to ensure that the patient is receiving the correct information and comprehending that information. It is important that doctors adapt themselves and transform into hybrid doctors due to the increase in the number of informed patients from technology, and this number will continue to increase with the amount of technology savvy people that are growing up. Information Communications Technology, or ICT, is another article that I found to be important in this course. ICT has had a major impact on human resources and the healthcare industry. The new advances in technology will have an impact on healthcare human resources on 3 different aspects. 1, there will be changes in efficiencies. In the next decade, there will be major development in comprehensive electronic health information systems. This will allow for information to be shared quickly and correctly, thus improving patient care outcomes and efficiency. Hospitals will be able to improve the quality of patient care by streamlining the process and minimizing the risk of medical errors. There will also be a shift in the availability of data, leading to evidence-based medical care. 2, there will be changes in types of medical care provided. ICT and advances in medical technology will have an impact on the medical care provided. There will be advances in genetics, protectonics, robotics, biomaterialists, and other technologies which will change the way doctors diagnose and treat all types of conditions. These changes may lead to shifts in specialties by doctors. And finally, there will be decentralization of the healthcare delivery system. There will be more of a role for community physicians and nurses. They will be able to do more in remote parts of the country. This will hopefully lead to a reduction in the burden of care for tertiary care centers and decreased wait times as well. And for the third aspect that interests me in this course was this article. Although short, was one of the most interesting topics that we discussed in all of the modules. It does a good job of encompassing all past modules and shows that while technology can be innovated and improve care, if patients are engaged, the technology will not have an effect. It is surprising to read that many digital health products with impressive results don't have the same effect in the real-world setting. This can be due to the lack of patient engagement. In a clinical setting, patients are able to use the technologies properly and have a ton of help. In the real world, these technology tools may not transfer over with the same benefits. If a technology has success in a clinical setting, it is crucial that these technology companies focus on patient engagement in order for them to have success in the real world. There are a few tools listed in this article that will help drive engagement. Maintain engagement first thinking, embrace real-world data, develop product variations, and seek partnerships to reap synergies. Once a technology is successful in the clinical setting, real-world evidence should be gathered to justify success at scale. Patient engagement is crucial to parlaying the clinical results to the real world. The aspect of this course which made me think the most had a lot to do with patient engagement and informed patients. Both of these are similar topics and involve having a patient who wants to be involved in care and improving their health. Overall, the aspect that I found to be the most interesting and caused reflection was the article about informed patients and hybrid doctors. I have been guilty of Googling symptoms and self-diagnosing myself with a condition. You don't realize how much this prior knowledge can affect the way you describe your symptoms at your appointment and the treatment that you choose in discussion with your doctor. While this knowledge can be beneficial, it can also cause problems. This seems to be a theme throughout the course. The advancement in technology has many benefits, but it also can have many consequences. In order to reduce the consequences, both patients and doctors have to adapt. It is better to have an informed patient because those patients want to improve their health and are motivated to get care. When an informed patient is misinformed, that is when the doctor needs to educate themselves and help the patient to understand their care better. Without doctors being aware that they are misinformed, the patient may not take medications properly or cause more harm to their care than good. And finally, my relation to work. This particular aspect of e-service in healthcare does relate to my work a little bit, but because I don't work in the healthcare industry, like for example at a hospital or at a clinic or something like that, it's like a little bit of a stretch for me to parlay the two things together. Currently, I work at a brokerage firm, and this means that I work with companies who want to provide health and wellness benefits to their employees. This can include health insurance, dental insurance, vision insurance, life and disability, and many other things. Every year we go through a renewal process where premiums for the different types of insurance are negotiated. Premiums are typically higher for populations with poor health. Informed patients typically care about their health and are proactive about their care. This will lead to a healthier population. A healthier population means lower premiums. Lower premiums mean happy employers, and happy employers are happy clients, which in turn makes my job easier. So while this doesn't really have a ton to do with my relation to work, it is the closest I can get to kind of creating an example of the two in between. If you have any questions, please feel free to reach out to me by email. I'd love to answer anything that you wanted to know.